my name is Carly Miller, and this is my evidence-based practice project proposal presentation on sepsis screening education, specifically for emergency department nurses. So for introduction, sepsis continues to be a leading cause of morbidity and mortality, especially among adult patients in emergency departments, where vague symptoms can rapidly escalate. Prompt recognition and intervention are essential for improving patient outcomes. However, despite advancements in sepsis management, delayed diagnosis and inconsistent use of screening protocols remains a challenge that negatively impacts prognosis. Implementing evidence based initiatives such as nurse education on sepsis screening is vital for improving early detection and ensuring standardized care for septic patients. Strengthening ED nurses' knowledge and confidence in identifying sepsis can lead to quicker interventions, reducing complications and mortality associated with the condition. For the PICO statement for this project, it is in adult emergency department patients, does implementing nurse education on sepsis screening and SIRS criteria during triage, when compared to sepsis screening by nurses without prior education, lead to 100% of nurses educated verbalizing understanding of sepsis screening over the course of 6 months. So, providing nurses with education on sepsis screening aligns with health policies aimed at promoting healthcare equity by ensuring timely and effective treatment for all patients, particularly those in vulnerable populations. Sepsis disproportionately impacts individuals from low income, minority, and rural communities where delays in recognition and treatment often result in poor outcomes. By standardizing nursing education programs, it will equip healthcare professionals with the necessary knowledge and skills to identify sepsis early and helping to reduce the disparities in patient outcomes. This initiative supports national health policies and it aligns with evidence based practice guidelines from organizations such as Centers for Medicare and Medicaid Services, which emphasize the quality improvement for underserved populations. By strengthening early detection and management strategies, nurses will contribute to a more equitable healthcare system, ensuring that all patients receive timely, life saving interventions regardless of their background or location. So, the organization that this project would be carried out at is Loma Linda University Medical Center Emergency Department. It is a large level 1 trauma center serving the Inland Empire, San Bernardino, and Riverside regions. Given the hospital's high acuity patient population and fast paced nature of the ED, this setting is well suited for implementing sepsis screening education. Effective utilization of sepsis screening tools is critical as ED nurses play a key role in triage and early identification of sepsis. The primary participants in this project will be the ED nurses responsible for triaging incoming patients, and education will be delivered through a dedicated sepsis training session, equipping nurses with the knowledge and skills used to use these screening tools effectively, recognize key criteria, and flag potential sepsis cases for provider evaluation, as well as initiate appropriate protocols, including ordering labs, cultures, fluids, and early antibiotics. The organizational culture for this hospital, it fosters a patient-centered culture dedicated to delivering high-quality care and improving patient outcomes. There's a strong emphasis on evidence-based practice that's evidenced through continuous professional development programs, interdisciplinary collaboration, and ongoing education initiatives that ensure that staff remain updated on latest clinical guidelines. Leadership actively promotes a culture of safety by encouraging open communication about advancements, potential risks, and opportunities for process improvements. Additionally, these healthcare professionals are deeply involved in the quality improvement initiatives, conducting audits, analyzing data, and implementing best practices to enhance care delivery. This commitment to excellence ensures that patient safety, satisfaction, and overall well being remain top priorities across all levels of the organization. So, the organizational readiness for this organization, it's shown a strong dedication to quality improvement initiatives with leadership actively supporting evidence-based practice and evidence-based practice projects. There is a shared understanding that enhancing sepsis screening can help reduce morbidity and mortality. Key stakeholders, including nurse managers, infection control specialists, and educators, specifically the sepsis educator, recognize the value of early sepsis detection and are committed to advocating for this initiative. Although the commitment to change is evident, successful implementation depends on available resources, staff engagement, and training capacity. While structured education programs provide the foundation for the training, additional resources may be needed to help address scheduling challenges and ensure comprehensive staff education. The integration of EHR with sepsis alerts further supports the feasibility of this initiative by offering a technological framework to help enhance the screening compliance. So, for our problem statement, sepsis remains a leading cause of morbidity and mortality, particularly in cases of severe septic shock. Patients may initially present with nonspecific symptoms, but the condition can rapidly progress, affecting multiple organ systems and significantly worsening patient outcomes. The target population for this initiative includes adult emergency department patients across all age groups, so young adults 18 to 44 who often seek care for minor illnesses or injuries, middle-aged adults 45 to 64 frequently present due to acute or chronic conditions, and older adults 65 plus commonly visit the ED for complications related to chronic illnesses, falls, or medication interactions. The demographic and health backgrounds of adult ED patients vary based on the community each hospital serves. Each emergency department nurse plays a critical role as a frontline caregiver and are key to recognize early signs of sepsis in adult patients, enhancing the nursing education prior to using it on the floor by focusing on vital signs and risk factors may improve early identification and timely treatment. Current protocols adhere to CMS guidelines for Sepsis 1, which rely on SIRS criteria to guide screening and initiate the sepsis bundle. This bundle includes obtaining blood cultures, measuring lactate levels, administering broad spectrum antibiotics, and providing fluid resuscitation. Additionally, Sepsis 1 integrates components of Sepsis 2, which expands on the use of SIRS criteria to further refine sepsis identification and management. For the literature review, there were 4 different articles selected. The first one is Nurses' Knowledge and Confidence in Recognizing and Managing Sepsis Patients, a multi-site cross-sectional study. So research from this study provides significant evidence that registered nurses across different practice areas only have moderate knowledge of sepsis care, indicating gaps in their understanding. The study found that nurses who had received sepsis education and training within the last year exhibited notably higher confidence levels than those who had not. However, their actual knowledge scores only showed slight improvement. While nurses displayed strong awareness of sepsis risk factors, many lacked familiarity with the updated Sepsis 3 definitions and current epidemiological data, which could lead to an underestimation of sepsis severity and negatively impact outcomes. Additionally, the study highlighted knowledge deficits regarding early recognition of tachypnea as signs of sepsis and key aspects of the sepsis bundle. These findings support the evidence-based practice proposal advocating for enhanced sepsis education for nurses as they demonstrate the need for improved training in sepsis screening and early intervention. The study also emphasizes the role of nurse educators and academic institutions in ensuring that sepsis education aligns with the latest evidence-based guidelines and practices. The next article was a qualitative study that explored emergency nurses' perspectives on their knowledge and role in identifying and managing sepsis. Participants identified both strengths and gaps in their understanding, as well as various factors, both positive and negative, that influenced their clinical practice and that of their colleagues in the emergency department. Several areas of suboptimal care were recognized, aligning with the previously identified models of clinical deficiencies. The study's findings contribute to shaping local and international emergency department policies and refining educational programs to improve sepsis care and patient outcomes. Despite some limitations, this study provided valuable insights into the challenges nurses face in recognizing and escalating care for septic patients, as well as difficulty in using those standardized sepsis screening tools. These findings suggest that targeted, context-specific education programs would help better prepare ED nurses to assess and manage sepsis effectively. The study reinforces the need for further education on sepsis protocols, supporting the proposed EBP initiative to improve nurse training in sepsis recognition and response. The next article is Sepsis Awareness to Enhance Early Identification of Sepsis in Emergency Departments. So this project investigated the differences between emergency department nurses who received early education and those who did not. The findings are particularly relevant for nurse leaders as they suggest that sepsis education might help reduce the time needed to recognize sepsis in patients. The study recommends that nurse leaders provide both initial and ongoing educational opportunities to ensure staff are well equipped to follow standing orders and institutional policies. This research supports the proposed EBP project as it demonstrates that nurses trained in sepsis screening schools, tools and search criteria are more confident in identifying and intervening early for septic patients. And the last article in the literature review was a systematic review that's the impact of sepsis education for healthcare professionals and students on learning and patient outcomes. So, this review evaluated 32 studies assessing the impact of sepsis education on healthcare professionals. The effectiveness of sepsis education was measured using all four levels of Kirkpatrick's classification, which examines learning outcome, knowledge retention, skill development, and application in a clinical setting. Which many studies assessed improvements in attitudes, knowledge, and skills, these metrics do not always directly correlate with enhanced clinical performance or patient outcomes. Although about half of the studies demonstrated improvements in patient care processes, attributing these outcomes solely to education is challenging, as many interventions also incorporated a multifaceted, protocol based sepsis care bundle. The review concludes that sepsis education, when combined with structured protocols, has a greater impact on patient survival when implemented independently. These findings emphasize the need for critical thinking, development, and comprehensive nursing education on sepsis. For this EBP, the change model used is Cotter's change model. So this 8-step change model was developed by John Carter, a Harvard professor in 1995. And it serves as a structured framework for organizations to implement and sustain change. Recognized for its emphasis on leadership involvement, stakeholder engagement, and systemic execution, the model has been widely applied to various industries, including healthcare. Its effectiveness is supported by extensive research and real-world implementation, making it a reliable tool. By outlining a clear step-by-step process, this model facilitates the successful integration and long-term sustainability of initiatives, such as a sepsis screening education program. The 8 steps are creating a sense of urgency, forming a guiding coalition, developing a vision and strategy, communicating the vision, removing obstacles, setting short-term goals, sustaining momentum, institutionalizing change, and together these steps provide a structured approach for implementing EBP. So specifically for this project, the way we would establish a sense of urgency is in the context of sepsis screening education. It can be achieved by presenting data on sepsis-related mortality, the financial impact of delayed diagnosis, the benefits of early screening interventions, and then engaging key stakeholders by including nurses, physicians, and hospital administrators through discussions, statistics, and real-life cases that can help reinforce the need for immediate action. For the second step, forming a guiding coalition. A multidisciplinary team is vital in leading the change effort. This coalition will include nurse educators, infection control specialists, quality improvement staff, and frontline nurses. Their collective role is to advocate for and facilitate the integration of sepsis screening education into clinical practice before the nurses utilize those sepsis screening tools in practice. For the next step, development of a vision and a strategy. So a well-defined vision ensures that stakeholders clearly understand the intended outcomes of the evidence-based project. For this initiative, the vision is to improve early sepsis recognition through comprehensive screening education, ultimately enhancing patient outcomes. The strategy will incorporate educational workshops, e-learning modules, and competency assessments to reinforce the knowledge and promote a consistent practice. Step 4, communicating the vision for change. Effective and ongoing communication is crucial for staff engagement. This step will involve distributing information through staff meetings, emails, posters, and presentations, emphasizing the importance of sepsis screening education. Leadership will also play a key role in addressing concerns, maintaining transparency, and ensuring that all team members understand the implementation process. Step 5 is removing barriers. So by addressing obstacles, it's essential for the success of any evidence-based project. So common challenges are staff resistance, time limitations, and resource shortages, which can hinder process. Solutions include offering incentives, integrating training into existing workflows, and securing leadership support to allocate protected learning time. Step 6, achieve short-term wins. Establishing early successes helps build momentum for sustained change. Short-term goals may include high completion rates for sepsis screening training, positive feedback from nursing staff, and initial improvements in screening compliance. Recognizing and celebrating these achievements will reinforce motivation and encourage continued adoption of the initiative. Step 5, is maintaining momentum. So, to ensure long-term success, ongoing reinforcement is necessary. This step includes continuous monitoring, periodic refresher training, and incorporating sepsis screening education into annual competency reviews. These efforts will help sustain improvements and prevent regression. And then finally, step 8, institutionalizing the change. The final step embeds the change into the organization's culture, ensuring its long-term success. So policy updates, strong leadership support, and routine integration into daily practice will help solidify adherence to new protocols. Continuous evaluation will also allow for refinements and ongoing improvements. So the implementation plan. The primary data collection tool for this EBP project will be surveys administered after the education sessions and again 4 months post-implementation. The initial survey will assess effectiveness of the sepsis education by asking nurses about the new information they learned regarding sepsis screening and its relevance to their practice. These post-education surveys will help evaluate whether nurses felt they gained useful knowledge from the training before they begin applying it in real clinical settings. The second survey will be conducted 4 months later to measure the impact of the training. It will focus on nurses' use of the sepsis screening tools, their improvement in screening abilities, and their confidence in applying those learned protocols. Both surveys will consist of a few concise questions to facilitate easy feedback from nurses. The sepsis education intervention will be delivered using a blend of in-person training sessions, online modules, and shift-based huddles to accommodate nurse varying schedules and ensure accessibility. The training will cover early sepsis recognition, effective use of screening tools, and adherence to evidence-based protocols. A comprehensive curriculum will be developed, including case studies, interactive learning activities, and real-life scenarios to enhance engagement and knowledge retention. Nurse educators or clinical leaders will lead the in-person sessions, while online modules will offer self-paced learning opportunities. To maintain consistency, all educators will undergo a brief preparatory session to review the content and obtain objectives of the program. Additionally, nurses will complete a pre-training assessment to measure their baseline knowledge and a post-training assessment to evaluate knowledge gained. Ongoing support will then be provided through refresher courses, continuous access to educational resources, and this structured approach will ensure that nurses are well prepared to apply the sepsis screening protocols effectively in practice, rather than just knowing what they are. So this slide shows a timeline. So the project can begin at any time and will span a total of 9 months, with the post-education surveys being used to assess the nurse confidence in identifying sepsis. Initially, the education will be incorporated as an additional class, offered alongside triage training for new hires, recent graduates, as well as a supplementary option for current nursing staff. After all current nurses have completed the education, ideally within a 3-month period, a post-education survey will be conducted to gauge whether the content was relevant and if nurses feel confident in applying that knowledge. Following this will be a 6-month implementation period and monitoring phase. The first 3 months of this phase will include the ED nurses applying the sepsis screening education in their daily practice. And then the final 3 months will be post-implementation surveys that will be administered to evaluate whether nurses feel they have successfully integrated the education into their practice. This will mark the conclusion of the 9-month EBP implementation period. For the evaluation plan, a paired t-test will be used to compare the pre and post intervention survey results, evaluating the statistical significance of any changes in nurse knowledge and confidence. This test is ideal for assessing differences within the same group over time, making it well suited for evaluating the effectiveness of educational interventions. The paired t-test will help determine whether sepsis screening education leads to significant improvements in nurse competency and adherence to protocols. Additionally, a chi-squared test will be used to analyze changes in adherence rates to sepsis screening protocols as recorded in chart audits. The chi-squared test is appropriate for categorical data and will identify any significant correlation between the educational intervention and improved adherence. By employing both of these statistical tests, the evaluation process is strengthened. The paired t-test will measure individual improvements with nurse knowledge and confidence, and the chi-squared test will examine a broader trends in clinical adherence. Together, these methods ensure that the data analysis accurately reflects whether the intervention has resulted in meaningful improvements in both knowledge retention and practical application. However, the paired t-test will be primarily used to address the PICO statement. In conclusion, the evidence-based project seeks to improve early sepsis identification in the emergency department by enhancing nurse knowledge, confidence, and adherence to sepsis screening protocols. By implementing targeted education, this project aims to standardize sepsis recognition and response, ultimately leading to timely interventions and improved patient outcomes. The structured evaluation plan will assess the impact of early intervention, providing data-driven insights into further refining future practices. Ensuring long-term success requires ongoing education, leadership, support, and interdisciplinary collaboration. With a commitment to continuous improvement, this project has the potential to create lasting advancements in sepsis care, reinforcing the role of nursing education and improving emergency department outcomes. So while currently there is a lot of different protocols and regulations in place for sepsis, this project focuses on a need for more in-depth education and specifically education on using sepsis screening tools effectively to help improve patient outcomes. And these are going to be the references for the project, including the literature review references. And that is the end of my presentation.